If you're over 60 and taking medication for high blood pressure or cholesterol, what I'm about to tell you could save your life. Right now, sitting in your medicine cabinet, there might be 2 pills you take every single day, pills your doctor prescribed separately. Pills that seem harmless on their own, but together, they're creating a silent storm inside your arteries that could double your risk of a massive heart attack. I'm speaking to you today not just as a healthcare professional, but as someone who has watched too many seniors end up in emergency rooms, confused and terrified because nobody warned them about this dangerous combination. And here's what makes this even more frightening. Most doctors don't catch this interaction because these medications come from different specialists. Your cardiologist prescribes one. Your primary care doctor prescribes the other. And nobody connects the dots. This isn't just about your heart. When these 2 medications combine in your bloodstream, they trigger a cascade effect that impacts your kidneys, your brain, even your ability to recover from simple illnesses. Men especially need to pay attention because this combination also affects blood flow to the prostate and can worsen urinary problems and even impact erectile function. Yes, the same blood vessels that feed your heart also feed everything else down there. Stay with me until the end, because I'm going to reveal the hidden mistake most seniors make that turns 2 life-saving medications into a ticking time bomb, and the simple question you need to ask your pharmacist tomorrow morning. Let me start by asking you something, and I want you to be honest with yourself. Do you take a pill for your blood pressure? Maybe a diuretic, something like hydrochlorothiazide or furosemide, or one of those water pills your doctor prescribed to keep your heart healthy. And here's the second question. Do you also take something for pain or inflammation? Perhaps ibuprofen for your knee pain, naproxen for your back, or even aspirin regularly because you read it's good for your heart. If you answered yes to both of those questions, I need you to listen very carefully to what I'm about to tell you. Because right now, at this very moment, those 2 medications might be working against each other inside your body in ways that could literally double your risk of a heart attack or stroke. These are the 2 medications I'm talking about. NSAIDs, that's non-steroidal anti-inflammatory drugs. You know them by their brand names, Advil, Motrin. Or maybe your doctor prescribed you a stronger version like meloxicam or diclofenac. And then there are the diuretics, the water pills that millions of seniors take every single day for high blood pressure or heart failure. Pills like Lasix, hydrochlorothiazide, or chlorthalidone. Now, here's what makes this combination so insidious. Both of these medications were prescribed or recommended by healthcare professionals. Both are meant to help you. Your diuretic protects your heart by controlling your blood pressure. Your NSAID gives you relief from the arthritis pain that makes it hard to sleep at night or play with your grandchildren. Separately, they're beneficial. Together, they create a perfect storm inside your cardiovascular system. Let me explain what's happening inside your body when you combine these 2 medications, because once you understand this, you'll realize why this isn't just about your blood pressure, it's about your survival. Your diuretic is working hard, right now as we speak, to flush excess fluid and sodium out through your kidneys. That's its job. It opens up the floodgates in your kidneys, letting water pour out, which reduces the volume of blood your heart has to pump. Less volume means less pressure. Lower blood pressure means less stress on your heart and arteries. That's exactly what you want. But then you take an NSAID for your arthritis pain or that nagging headache, and it does something sneaky, something your doctor might not have explained. NSAIDs tell your kidneys to hold on to sodium and water. They literally reverse what your diuretic is trying to accomplish. It's like you're pressing the gas pedal and the brake pedal at the exact same time, expecting your car to move forward smoothly. According to research published by the National Institutes of Health, this combination creates what medical professionals call cardiorenal stress. In plain English, your heart and kidneys are being torn in opposite directions, and the strain is enormous. Let me break down the science in a way that makes sense. Think of your kidneys as a sophisticated filter system, like the filtration system in a swimming pool, but a million times more complex. Your diuretic opens the gates wide, letting water and sodium pour out freely. Blood pressure drops. Everything seems fine. But when you introduce an NSAID into your system, it produces a chemical signal that tells those kidney gates to slam partially closed. Why? Because NSAIDs block the production of something called prostaglandins, natural chemicals your kidneys need to keep blood flowing properly and maintain healthy filtration. Without adequate prostaglandins, your kidney vessels constrict. They tighten up. Now your blood pressure starts creeping back up. Your heart, which was finally getting a break thanks to the diuretic, suddenly has to work harder again. Your arteries, especially if you're over 60, are already somewhat stiff from decades of wear and tear. They don't flex and stretch like they did when you were younger. So when that pressure rises, even by just 10 or 15 points, it's like inflating an old tire beyond its capacity. And here's what most people don't realize. This isn't just about the numbers on your blood pressure monitor. Over time, and we're talking weeks, not years, this constant tug of war creates microscopic damage in the lining of your blood vessels. Tiny tears. Rough patches where smooth arterial walls used to be. And you know what loves to stick to rough patches? Cholesterol, platelets, blood cells. They clump together, forming plaques. And plaques lead to blockages. And blockages lead to heart attacks and strokes. Clinical studies have shown that elderly patients taking NSAIDs with diuretics face approximately a twofold increased risk of hospitalization for congestive heart failure compared to those taking diuretics alone. Twofold. That means your risk doubles just from combining these two common medications. But the blood pressure problem is just the tip of the iceberg. What most people, and frankly, what many doctors don't emphasize enough, is that this combination doesn't just affect your heart. It devastates your kidney function in ways that can be irreversible if caught too late. Your kidneys are already under stress from the diuretic. They're working overtime to filter your blood with less volume flowing through them. Now add an NSAID that reduces blood flow to the kidneys even further, and you've created a crisis. Your kidney function begins to decline. Waste products that should be filtered out start accumulating in your bloodstream. Potassium levels can spike dangerously high. And high potassium? That can stop your heart. I've personally seen patients, good, responsible people who took their medications exactly as directed end up in the emergency room with acute kidney injury because nobody told them that popping a couple of Advil every day for knee pain could interact so catastrophically with their blood pressure medication. And gentlemen, here's something else you need to know. When your kidney function drops, it doesn't just affect your heart and your lab numbers. It affects blood flow everywhere in your body, including the blood flow to your prostate and the blood vessels that control erectile function. That's right, the same arterial damage and reduced blood flow that threatens your heart is also impacting your ability to maintain healthy erections and normal urinary function. But as serious as the blood pressure and kidney problems are, there's a second deadly effect of this combination, one that shows up silently on your lab work, one that your doctor might glance at and miss entirely, and one that can trigger a cascade of life-threatening complications within days. And that brings us to the crisis happening inside your kidneys right now. Let me tell you something that most doctors don't spend enough time explaining. Your kidneys are the unsung heroes of your body. Right now, as you're listening to me, these two fist-sized organs sitting just below your rib cage are performing an absolute miracle. Every single minute, every single day, they filter about half a cup of blood, that's roughly 50 gallons every 24 hours. They're removing waste products, balancing your electrolytes, regulating your blood pressure, even producing hormones that keep your bones strong and your blood healthy. Your kidneys are working overtime to keep your entire system in perfect harmony. But here's what nobody warns you about. When you combine diuretics with NSAIDs, you're not just creating a minor inconvenience for these organs. You're putting them in a chokehold. You're strangling the very organs that are desperately trying to keep you alive. And the terrifying part? This kidney damage happens silently. You don't feel it. You don't see it. By the time symptoms appear, significant damage has already been done. Let me walk you through exactly what's happening inside your kidneys when you take these two medications together. Because once you understand this mechanism, you'll realize why this combination is so devastating. When you take a diuretic, it deliberately reduces the volume of blood flowing through your kidneys. That's the whole point. Less fluid in your bloodstream means lower blood pressure. But your kidneys are smart. They adapt. They produce special chemicals called prostaglandins that act like tiny gatekeepers, keeping the blood vessels inside your kidneys open wide, so they can still filter your blood properly despite the reduced flow. Think of prostaglandins as the emergency backup system. When blood flow drops, they kick in automatically, dilating those kidney blood vessels to maintain adequate filtration. It's brilliant, really. Your body has built-in safeguards. But here's the disaster. NSAIDs block prostaglandin production. That's actually how they reduce inflammation and pain, by blocking these chemicals. But prostaglandins don't just control inflammation. They're essential for kidney function, especially when you're taking a diuretic. So what happens? Your diuretic reduces blood flow to the kidneys. Your kidneys try to compensate by producing prostaglandins to keep vessels open. But the NSAID you took for your back pain blocks those prostaglandins. Suddenly, your kidney blood vessels constrict. They tighten up at the exact moment they need to stay open most. It's like trying to breathe through a straw while someone's pinching it closed. Your kidneys are gasping for blood flow, and they're not getting it. This condition is called acute kidney injury. And gentlemen, I need you to understand how fast this can happen. We're not talking about gradual decline over years. This can happen within days or weeks of combining these medications. According to research published in Pharmacoepidemia and Drug Safety, elderly patients taking NSAIDs with diuretics face an approximate 2-fold increased risk of acute kidney injury requiring hospitalization. 2-fold means your risk doubles. And once acute kidney injury begins, here's the cascade of horrors that follows. First, your kidneys start failing to filter waste products properly. Toxins that should be eliminated, creatinine, urea, other metabolic waste, begin accumulating in your bloodstream. You might feel tired, nauseous, confused. Most people chalk it up to getting older or not sleeping well. Second, and this is critical, your electrolytes go haywire. Potassium levels spike dangerously high because your kidneys can't excrete it properly anymore. And high potassium hyperkalemia, we call it, can literally stop your heart in its tracks. It disrupts the electrical signals that make your heart beat in rhythm. 1 minute you're fine, the next you're in cardiac arrest. I've personally witnessed patients go from completely normal kidney function to needing dialysis in a matter of weeks because they were taking both medications without anyone, not their doctor, not their pharmacist, catching the dangerous interaction. These were responsible people who took their medications exactly as prescribed. They didn't abuse anything. They just didn't know. And here's what makes it even more heartbreaking. Many of these cases are completely preventable if caught early. Now let's talk about the cruel irony of this situation. Remember why you're taking that diuretic in the first place. To protect your heart by controlling your blood pressure, right? That's what your doctor told you. Lower blood pressure means less strain on your heart, lower risk of heart attack and stroke. But when your kidneys start failing because of this drug combination, guess what happens? Your blood pressure doesn't just stay elevated. It skyrockets even higher than before you started the diuretic. Why? Because your kidneys control blood pressure through a complex hormonal system. When they fail, that system goes haywire. You end up with worse blood pressure than when you started, despite taking the medication. It's a vicious cycle. You take the diuretic to lower blood pressure. You take the NSAID for pain. The combination damages your kidneys. Your damaged kidneys cause your blood pressure to spike. Your doctor increases your diuretic dose. The problem gets worse. And gentlemen, here's something that hits particularly close to home for men. Reduced kidney function doesn't just affect your blood pressure and your lab numbers. It means reduced blood flow everywhere in your body, including to your prostate and to the delicate blood vessels that control erectile function. The same arterial constriction and reduced blood flow that's damaging your kidneys is also impacting your sexual health. That's why this combination often causes or significantly worsens erectile dysfunction and urinary problems. The blood vessels in your pelvis are just as vulnerable as the ones in your kidneys. When kidney function drops, so does blood flow to your penis and prostate. Many men come to me complaining about erectile dysfunction or difficulty urinating. And when I review their medications, there it is, a diuretic and an NSAID taken daily. They had no idea these seemingly unrelated pills were stealing their vitality. But here's the good news, and I want you to hold on to this. Your kidneys are remarkably resilient organs if you catch this problem early. Unlike some organs that scar permanently, kidneys have an extraordinary capacity to heal and regenerate function if the damaging medications are stopped or adjusted before permanent scarring occurs. I've seen kidney function improve dramatically within weeks of stopping the NSAID or switching to a safer pain management strategy. The key is catching it early, before you cross the point of no return. But as serious as the kidney damage is, there's a third danger of this combination that's even more immediate, and it strikes without warning, often in the middle of the night when you least expect it. We need to talk about what's happening inside your brain right now. Picture this scenario and tell me if it sounds familiar. Your blood pressure has been perfectly controlled for months, maybe even years with your diuretic. You go to your doctor's appointments, and every time they wrap that cuff around your arm, the numbers are beautiful. 120/80, maybe 125/82. Your doctor smiles, tells you you're doing great, and sends you on your way. You feel good. You feel protected. You think you've got this blood pressure thing under control. Then winter comes. Your knee starts acting up from that old injury. Or maybe it's your lower back from years of hard work. So you do what millions of Americans do, you reach for the ibuprofen. Not just once, but 3 times a day. 600 milligrams with breakfast, 600 with lunch, 600 before bed. It's over the counter. It's safe, right? Within a week, just 7 days, your blood pressure spikes by 15 to 20 points. But here's the terrifying part. You don't feel it. There's no alarm bell. No chest pain. No warning. You have absolutely no idea it's happening. But inside your brain, at this very moment, something catastrophic is brewing. A storm is building in the delicate blood vessels that keep you thinking, moving, and alive. Let me explain exactly what happens when NSAIDs counteract your diuretic, because this isn't just about your blood pressure rising a little bit. We're talking about unpredictable, dangerous surges in arterial pressure that your aging blood vessels simply cannot handle. When you're taking your diuretic alone, your blood pressure stays relatively stable. The medication keeps fluid levels down, and your heart doesn't have to pump as hard. Your arteries, especially the tiny, delicate ones in your brain, are under manageable stress. But the moment you introduce an NSAID like ibuprofen into your system, everything changes. As we discussed before, the NSAID tells your kidneys to retain sodium and water. Your blood volume increases. Your heart has to pump harder. And your blood pressure doesn't just creep up gradually, it can surge dramatically and unpredictably throughout the day. Now your arteries, especially if you're over 60, aren't what they used to be. Think of them as old garden hoses that have been stretched and compressed and left out in the sun for decades. They've lost their elasticity. They've got weak spots. They've got areas where the walls have thinned out from years of wear and tear. When you're young, your arteries can flex and expand to accommodate sudden increases in blood pressure. But at 60, 70, 80 years old, those vessels are rigid. They're brittle. They can't adapt anymore. One sudden spike in pressure, just one, and those delicate blood vessels in your brain can rupture. Blood pours out into the surrounding brain tissue, killing cells, creating swelling, increasing pressure inside your skull. That's a hemorrhagic stroke. And hemorrhagic strokes are often fatal or leave survivors with devastating permanent disabilities. According to the FDA's own black box warning, NSAIDs can increase the risk of heart attack and stroke. And this risk can occur within the first few weeks of use, especially in people with existing heart disease or high blood pressure. But here's where this situation becomes even more dangerous, and this is something that confuses even many healthcare professionals. NSAIDs don't just affect your blood pressure. They also affect your blood's ability to clot properly. And different NSAIDs do different things, which makes this whole situation a minefield. Aspirin, which is technically an NSAID, thins your blood by preventing platelets from sticking together. That's why doctors prescribe low-dose aspirin for heart attack prevention. It keeps your blood from forming dangerous clots in your arteries. But other NSAIDs like ibuprofen and naproxen, they can actually interfere with aspirin's protective effect. Research published in Circulation, a journal of the American Heart Association, showed something shocking. Individuals taking aspirin along with NSAIDs regularly, we're talking 60 or more days a year, had a relative risk of heart attack increased to 2.86 compared to those taking aspirin alone. Let me say that again. Taking ibuprofen regularly with aspirin can almost triple your heart attack risk. The NSAID blocks the aspirin from doing its job of preventing blood clots. So now you've got a nightmare scenario. Unstable, elevated blood pressure combined with altered blood clotting. You've created the perfect recipe for both types of stroke: hemorrhagic strokes from ruptured blood vessels, and ischemic strokes from blood clots blocking arteries in your brain. The numbers on this are absolutely chilling. Studies have shown that seniors taking NSAIDs with blood pressure medications like diuretics have up to a 50% higher risk of stroke within the first 30 days of starting this combination. 50%. That's not a minor increase in risk. That's not something you can brush off. That's essentially a coin flip with your life every single month you continue taking these medications together. And remember, the FDA states that the increased risk of heart attack and stroke from NSAIDs can happen within the first few weeks of use. You don't have to be taking these medications for years to be in danger. The damage can happen fast. The American Heart Association has been clear in their guidance. Patients with cardiovascular disease or those who have had a heart attack should avoid NSAIDs entirely and use acetaminophen, that's Tylenol, as a first-line alternative for pain relief, unless otherwise directed by their cardiologist. Here's what makes this even more tragic. Many seniors experience warning signs and completely miss them. You feel dizzy when you stand up. You have moments of confusion where you can't quite remember what you were saying. You get sudden, severe headaches that you've never experienced before. Maybe you have brief episodes where your vision goes blurry or you can't find the right words. Most people dismiss these symptoms as just getting older or not sleeping well or stress. But these could be transient ischemic attacks, TIAs, what we call mini strokes. They're your brain's way of screaming for help before the big one hits. A TI is like a fire alarm before the building burns down. It's your warning. It's your chance to change course before permanent damage occurs. But most people ignore it, and they keep taking their medications without realizing the danger. Gentlemen, if you've experienced any of these symptoms while taking an NSAID with a diuretic or blood pressure medication, you need to talk to your doctor immediately. Not next month at your regular checkup, tomorrow, now. You might be thinking, but surely my doctor would have told me about this, right? Surely my pharmacist would have caught this dangerous interaction? That's what brings us to the most shocking and frankly infuriating part of this entire crisis. And it's not what you think. Here's an uncomfortable truth that nobody in healthcare wants to admit. The average senior in America sees multiple doctors and fills prescriptions at different pharmacies. And in that fragmentation, people are falling through the cracks and dying. Let me paint you a picture that's probably very familiar. Your cardiologist prescribes your diuretic, maybe it's hydrochlorothiazide or furosemide. That's his specialty. He's focused on your heart and your blood pressure. Then you see your orthopedic surgeon for your knee arthritis, and he suggests ibuprofen or writes you a prescription for a stronger NSAID like meloxicam. That's his lane. He's treating your joint pain. Meanwhile, your primary care doctor is managing your diabetes, your cholesterol, maybe your prostate issues. He's juggling 10 different things during your 15-minute appointment. But here's the critical question. Who is looking at the complete picture? Who is standing back and saying, wait a minute, this patient is taking a diuretic and an NSAID. That's a dangerous combination. The answer, far too often, is nobody. Now, I want to be very clear about something. This isn't about bad doctors. The physicians I'm describing are competent, caring professionals who went into medicine to help people. This is about a fragmented, overwhelmed healthcare system that simply isn't designed to catch these interactions. Your cardiologist has no idea you're buying a Lebi over the counter at CVS. Why would he? You didn't think to mention it because it's just an over-the-counter pain reliever. Your orthopedic surgeon doesn't know what your cardiologist prescribed because they're in different hospital systems with different electronic medical records that don't talk to each other. Your pharmacist might flag the interaction if you fill everything at the same pharmacy. But how many seniors do that? You get your prescription diuretic filled at Walgreens near your house. You pick up ibuprofen at the grocery store. Maybe you order some supplements on Amazon. Nobody has the complete list except you, and you probably don't realize it matters. And even when everything is tracked in one pharmacy system, here's the reality. Interaction alerts pop up constantly. A busy pharmacist filling 200 prescriptions a day sees dozens of alerts. Some are critical. Some are minor. Some are theoretical. When you're overwhelmed and understaffed, it's easy to miss the critical ones in the noise. This is a system's failure, pure and simple. And you're the one paying the price. But here's the biggest danger of all. And this is something I see constantly in my practice. Most people don't consider over-the-counter NSAIDs as real medication. Think about it. If your doctor prescribed you a medication, you'd carefully read the label. You'd probably mention it at your next appointment. You'd think of it as serious medicine. But that bottle of Advil you grabbed at the grocery store while picking up milk? That's not real medication in most people's minds. That's just pain relief. It's over the counter. It must be safe. Let me be absolutely clear. That bottle of ibuprofen you bought without a prescription is just as powerful and just as dangerous in combination with your blood pressure medication as prescription strength NSAIDs. The active ingredient is the same. The mechanism of action is the same. The risk is the same. I cannot count the number of times I've asked a patient, "What medications are you taking?" And they list their prescriptions, but never mention the Advil they take 3 times a day, the Aleva they take for their back, the aspirin they take because they read it's good for their heart. You wouldn't skip telling your doctor about a prescription blood thinner. But how many times have you mentioned your daily ibuprofen habit? Probably never. And that silence could literally kill you. Here's something that surprises most people. You don't have to be taking massive doses of NSAIDs for this interaction to be dangerous. Taking just 400 milligrams of ibuprofen, that's 2 regular strength pills 3 times a week, is enough to significantly interfere with your diuretic and increase your cardiovascular risk. 3 times a week. That's nothing. That's taking it occasionally for a headache or sore muscles. Daily use? You're in the danger zone. And gentlemen, I know many of you are taking NSAIDs every single day for chronic pain without realizing. You're undermining your blood pressure control and slowly poisoning your kidneys. The American Geriatric Society, through something called the Beers criteria, specifically cautions against the use of NSAIDs in older adults, particularly those with heart failure or uncontrolled hypertension. The National Institute on Aging echoes this warning. These aren't fringe opinions. This is mainstream geriatric medicine saying that NSAIDs are dangerous for seniors, especially when combined with blood pressure medications. But nobody's telling you this at the pharmacy counter when you buy that bottle of Advil. Here's what makes this combination so insidious, so terrifying. The damage happens gradually and silently. You don't feel your blood pressure rising 5 or 10 points. You don't feel your kidney function dropping by 10 or 15%. There's no pain. No alarm bells. No warning system. Your body is deteriorating, your organs are being damaged, and you have absolutely no idea it's happening. By the time symptoms finally appear, severe swelling in your legs, shortness of breath that won't go away, chest pain, confusion from toxin buildup, serious, potentially irreversible damage has already occurred. You're not catching this early. You're catching it when your kidneys are already in crisis, when your heart is already failing, when your blood pressure has been dangerously elevated for weeks or months. The research published in Pharmacoepidemio and Drug Safety showed that elderly patients taking NSAIDs with diuretics had approximately a 2-fold increased risk of hospitalization. For congestive heart failure, 2-fold, double the risk. And most of these patients had no idea they were in danger until the ambulance was rushing them to the emergency room. Gentlemen, I need to address something that hits particularly close to home for men, because this isn't just about your heart and kidneys. Reduced blood flow from uncontrolled blood pressure and declining kidney function directly impacts erectile function and prostate health. The same arterial damage that's happening in your heart is happening in the delicate blood vessels in your pelvis. When your blood pressure is elevated and your kidney function is compromised, blood flow to your penis decreases. The smooth muscle cells that allow you to achieve and maintain an erection need healthy blood flow. When that flow is restricted, erectile dysfunction follows. The same is true for your prostate. Reduced blood flow means reduced oxygen and nutrient delivery. It means inflammation. It means worsening urinary symptoms, difficulty starting urination, weak stream, frequent nighttime trips to the bathroom. Many men come to me complaining about sexual dysfunction or urinary problems. And when I review their medication list, there it is, a diuretic and an NSAID taken daily for months or years. They had no idea these seemingly unrelated pills were stealing their vitality, their quality of life, their confidence. So what's the solution? How do you protect yourself if you genuinely need blood pressure control and pain relief? How do you navigate this minefield when the healthcare system clearly isn't designed to protect you? That's where we're headed next, and this is the most important part of everything I'm telling you today. The hidden mistake isn't just taking these medications together. Let me be very clear about this, because I need you to understand the depth of this problem. The real mistake, the one that's killing thousands of seniors, Every year is assuming that because both medications were prescribed or recommended by healthcare professionals, they must be safe together. The mistake is trusting a fragmented system to catch what only you can prevent. You took your diuretic exactly as prescribed. You took your NSAID exactly as directed. Or maybe you just bought it over the counter like millions of Americans do every day. You did everything right, according to the instructions on the bottles. And yet, you're in danger. This is the uncomfortable truth. In our current healthcare system, you are the only person who has the complete picture of everything you're taking. You are the last line of defense. And if you don't speak up, if you don't ask the right questions, nobody else will. But here's where this story takes an even darker turn. And this is the climax moment I promised you at the beginning. We've been talking about NSAIDs and diuretics. But many seniors aren't just taking those two medications. They're taking a third one that makes this combination even more deadly. Low-dose aspirin. Millions of seniors take a baby aspirin every day for heart protection. Their doctor told them it helps prevent heart attacks and strokes by keeping their blood thin and preventing clots. And that's true. Aspirin is life-saving medication when used appropriately. But here's what most men never realize until it's too late. When you combine aspirin with other NSAIDs like ibuprofen, something catastrophic happens at the molecular level. Both aspirin and ibuprofen bind to the same exact site on an enzyme called COX-1. This enzyme is responsible for aspirin's anti-clotting, heart protective effect. But if you take ibuprofen before your aspirin, even by just an hour or two, the ibuprofen molecules get there first and occupy that binding site. They block the aspirin from doing its job. Your aspirin becomes useless. The medication you're taking to prevent a heart attack stops working. You think you're protected, but you're not. The research on this is absolutely chilling. A study published in Circulation, a journal of the American Heart Association, found that individuals taking aspirin along with NSAIDs regularly, we're talking 60 or more days a year, had a relative risk of heart attack increased to 2.86 compared to those taking aspirin alone. Let me say that number again, 2.86. That means your risk nearly triples. You're taking aspirin to protect your heart, but the ibuprofen you're also taking is canceling out that protection and making you more vulnerable than if you weren't taking anything at all. So, now picture this nightmare scenario. You're taking a diuretic for blood pressure. You're taking low-dose aspirin for heart protection. And you're taking ibuprofen for arthritis pain. That's 3 medications, what medical professionals sometimes call the triple threat or triple whammy. The diuretic and NSAID are destroying your kidneys and spiking your blood pressure. The NSAID is blocking your aspirin from protecting against blood clots. And all 3 together are creating a perfect storm that accelerates damage exponentially, not just additively. This is happening right now in medicine cabinets across America. Good people, responsible people, taking their medications as directed, completely unaware they're playing Russian roulette with their cardiovascular system. But here's the hope, and I need you to hear this. You don't have to suffer in pain to protect your heart. You have options that are safe and effective. Acetaminophen, that's Tylenol, doesn't have the same dangerous interaction with diuretics that NSAIDs do. It works through a completely different mechanism. It doesn't block prostaglandins in your kidneys. It doesn't interfere with aspirin's protective effects. It doesn't cause fluid retention or spike your blood pressure. The American Heart Association, the FDA, and virtually every major medical organization recommends acetaminophen as the first-line pain reliever for people with heart disease or high blood pressure. It's not perfect for every type of pain, but for many seniors, it's effective enough and dramatically safer. For chronic arthritis pain, topical NSAIDs creams and gels like Motrin gel deliver relief directly to your joints without flooding your entire bloodstream. You get the anti-inflammatory benefit right where you need it, with minimal absorption into your system. That means minimal impact on your kidneys, blood pressure, and heart. And here's something doctors don't emphasize enough: physical therapy. Heat therapy, gentle exercise, and weight management often work better than pills for chronic pain anyway. I know that's not the quick fix people want to hear, but it's the truth. Strengthening the muscles around your joints, maintaining flexibility, reducing inflammation through diet. These approaches actually address the root cause instead of just masking symptoms. Now I want you to do something tomorrow morning, not next week, not when you get around to it. Tomorrow morning. This is simple, but it could literally save your life. Take every medication you use, and I mean every single one. Prescriptions, over-the-counter pills, vitamins, supplements, herbal remedies, everything, and put them in a bag. Take that bag to your pharmacist or your doctor. Ask this exact question, word for word. Are any of these medications dangerous to take together? Especially considering my age and kidney function. Don't be vague. Don't assume they already know. Don't assume the computer system caught everything. Ask explicitly. Make them look at every single item. Make them check for interactions. The FDA has specific guidance on this. They recommend that if you must take both aspirin and ibuprofen, you should take immediate-release low-dose aspirin at least 2 hours, before or 30 minutes after taking ibuprofen to minimize the interaction. But honestly, the safer approach is to avoid combining them all together and use acetaminophen instead. And while you're advocating for yourself, demand a comprehensive metabolic panel if you haven't had one recently. This blood test checks your kidney function, specifically your creatinine level and your GFR, which stands for glomerular filtration rate. Your GFR tells you how well your kidneys are filtering waste. A normal GFR for your age should be above 60. If it's dropping into the 40s or 30s, your kidneys are in trouble. You also need your electrolytes checked, especially potassium. High potassium, as I mentioned earlier, can stop your heart. And don't just accept one blood pressure reading at the doctor's office. Ask for your blood pressure trends over time. One reading tells you almost nothing. Trends tell you everything. These numbers tell the truth about what's happening inside your body. They don't lie. They don't sugarcoat. And they often reveal problems long before you feel symptoms. I know some of you are thinking, but I don't want to be difficult. I don't want to waste my doctor's time. I don't want to seem like I'm questioning their expertise. Let me be very clear. You are not being difficult. You are not wasting anyone's time. You are taking control of your health in a system that, through no one's fault, is simply not designed to protect you from these invisible dangers. Your doctor wants you to be informed and engaged. Your pharmacist would rather spend 5 minutes reviewing your medications than see you hospitalized with kidney failure or a heart attack. This isn't about doubting healthcare professionals. This is about recognizing that you are the only person who sees the complete picture of your health, your medications, and your daily habits. You have the right and, frankly, the responsibility to ask questions, to advocate for yourself, to demand answers. And this brings me to why I'm so passionate about making sure you understand this. Why I made this video, why I'm practically begging you to take action. Because here's what I want you to understand, what I need you to believe. It's never too late. I've been practicing medicine for decades, and I've seen something remarkable happen again and again. I've seen men in their 60s, 70s, even 80s, make simple medication changes and watch their bodies heal in ways that seem almost miraculous. I've seen kidney function improve within weeks of stopping a dangerous drug combination. I've seen blood pressure stabilize. I've seen men regain energy, clarity, even sexual function they thought was gone forever. Your body wants to heal. Your kidneys want to regenerate. Your blood vessels want to repair. But you have to give them the chance. You have to remove the obstacles that are standing in the way. The damage from these medication interactions isn't always permanent, not if you catch it now. Not if you take action today, instead of waiting until symptoms force you into an emergency room. Gentlemen, you've spent your whole life taking care of others. You've worked hard. You've provided for your families. You've sacrificed. Now it's time to take care of yourself with the same dedication and attention you've given to everyone else. You deserve to enjoy your retirement years. You deserve to play with your grandchildren without chest pain. You deserve to wake up without feeling exhausted and confused. You deserve to maintain your dignity, your independence, your vitality. But that only happens if you speak up. If you take that bag of medications to your doctor tomorrow. If you demand those lab tests. If you refuse to accept, that's just part of getting older, as an answer when something doesn't feel right. If this video opened your eyes to dangers you didn't know existed, do me a favor. Hit that subscribe button. I make these videos because I've seen too many preventable tragedies, and I'm committed to making sure you have the information you need to protect yourself. And here's my question for you, leave it in the comments below. Are you currently taking any combination of these medications? A diuretic, an NSAID or aspirin? Have you ever experienced symptoms that might have been warning signs, dizziness, confusion, swelling, fatigue? Share your story. Your comment might be the wake-up call that saves someone else's life. Take care of yourselves, gentlemen. Your life is worth fighting for.